Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk all about stimulant abuse. So there is a disorder called stimulant use disorder, and that focuses on drugs like cocaine and amphetamines. And today you're going to learn all about the criterion for the diagnosis. You're going to learn about all the different subtypes of this diagnosis. Then we're going to go through each of these drugs, cocaine and amphetamine, and we're going to talk about how they became popularized, some of the features of what happens under the influence, and how they are formed, such as in the powder form or the rock form. And then we'll summarize at the end. So if you like what I have to offer, hit the like button, subscribe, click the notifications tab. This allows me to bring this video to a larger audience. Without further ado, let's talk about stimulant use. So what do we mean when we use the term stimulant use disorder? Well, we use this term when a person engages in irregular use or misuse of things like cocaine or amphetamine. These are the major contributors to what we call a stimulant use disorder. And whatever stimulant the person has is going to start to dominate their life and interfere with their social relationships and their performance at work or in the classroom. So let's get into the nitty-gritty. So all substance use disorders require us to track them for 12 months. And in order to meet the criteria of a substance use disorder, all substance use disorders require a minimum of 2 of the following features. So for stimulants, it is taking more of this drug through time than is intended, unsuccessful attempts to cut down from the drug, spending a lot of time trying to access, use, or recover cravings, interference with work, school, or home obligations, interference with social or interpersonal relationships, reduced activities, whether it be social, occupational, recreational, as a function of this stimulant use, engaging in risky behavior while under the influence of stimulant use, such as driving or operating heavy machinery, and then using despite knowing how this drug has impacted you or is likely to impact you. So with a stimulant use disorder, you only need 2 of the features, but we're going to talk about being more specific as a function of however many features you have. So additionally, in addition to having 2 features from criterion A, criterion B is tolerance, right? And what is tolerance? That is either the same amount of the drug no longer provides the same effect, so there's a lessened effect of the drug, or the need to increase the amount of a drug to reach a previously acquired high. So that's tolerance. And then when we talk about withdrawal is what happens when you're no longer using the drug. So a person may either experience these adverse reactions when coming off the drug. So for stimulants, we refer to withdrawal as crashing or coming down. And that's a very uncomfortable experience. So either the person reports this uncomfortable experience, or in order to avoid that uncomfortable experience, they continue to use so that they don't go into withdrawal. So these are the 3 general criteria or cluster areas. And it's important to understand that whatever this medication is, it can't be that you're using it based on proper prescription. It has to be a recreational use or an abnormal use of a properly prescribed medication. So if you're taking a stimulant such as Ritalin or Adderall for the purpose of ADHD or narcolepsy, well, that's properly prescribed to you. And if you're following the dose that was properly prescribed, we would not give you a stimulant use disorder. You would either have to start abusing the drug, which is to deviate from what is medically prescribed, or you would have to develop some kind of dependency outside of what it was prescribed for. So the severity matters. If I am a clinician and I am referring a person for therapy or receiving a person for therapy, I want to know the extent to which this substance use is impacting them. So we would categorize the substance use as mild if there are 2 to 3 symptoms, moderate if there are 4 to 5, and we would consider it fairly severe if there are 6+ symptoms. So that's the current severity. But what happens if a person is no longer using cocaine or amphetamine? Now we can give a diagnosis called a stimulant use disorder in remission. And we have to specify whether it's early remission or whether it's sustained remission. Early remission is that the person no longer is meeting any of the criteria of a stimulant use disorder. Now, they would have had to previously met the criteria, and now they're sober. And they're no longer experiencing any of the symptoms of stimulant use disorder for at least 3 months. So if it's 3 months up to a year, we call that early remission. If it's 12 months or longer, or a year or longer, we refer to that as sustained remission. Now, one of the symptoms and criteria A is cravings. It's important to note that that is the one criteria that we don't consider, because it is possible that someone is remaining sober but has the urge to use cocaine or amphetamine, but they're superseding it. And as long as the other features are not there, we can call it in remission. And then we also have to address if they're not using because they're in some kind of rehabilitation center or whatnot. So, or in a prison setting, we might say stimulant use disorder in remission in a controlled environment, something to that effect, which says this person is not using cocaine, this person is not using amphetamine, but the reason is because they have no access to it, because they're in rehab or they're in prison setting or whatnot. So we specify that. Now, because the stimulant use disorder can be cocaine, amphetamine, or other forms of stimulants, we do need to specify whether it's an amphetamine type or a cocaine type substance use disorder. Now, what I will tell you is that we don't use a stimulant use disorder when it comes to things like nicotine or caffeine, even though they have stimulant properties. And the reasoning is that they have their own diagnoses, which I'll go through separately. So now that you understand how to diagnose a stimulant use disorder, let's talk about what the effect of cocaine and amphetamine actually looks like. So let's start with cocaine. Cocaine is the most powerful natural stimulant known, right? So it is naturally growing, and it provides a sense of euphoria, a rush, and that rush is due to dopamine. Dopamine creates these pleasure reactions, very strong pleasure reactions throughout the brain. And cocaine binds to the same neurons that are linked to dopamine. So that rush we see, that euphoria we see, is due to increased dopamine levels in the brain. One point of caution, though, is that very high dopamine levels can induce psychotic states. So you can have something called a cocaine-induced psychotic disorder. So we have to be mindful of, sure, it's going to create this rush, increased dopamine levels, but if it gets too high, that's going to be significantly problematic. So dopamine is the primary neurotransmitter at play, responsible for the euphoria, but that doesn't mean that there aren't other neurotransmitters implicated in the experience we have with cocaine use. So norepinephrine and serotonin are also involved, and we see increases in these neurotransmitters as well. So as I said, high doses of cocaine can really produce paranoia, manic features, very similar to a manic phase of bipolar disorder, and it can induce hallucinations and delusions. Now, I said that we refer to this as a cocaine-induced psychotic disorder. What's interesting is that when we talk about schizophrenia, we're going to see a very similar thing. It is excess amount of dopamine that is responsible for the hallucinations and the delusions that people experience when they have a psychotic episode, right? So that's very important. Now, that's under the influence. So you have this euphoria, very high doses, you can have mania or paranoia or psychotic states. Now, what happens when a person is coming off the drug? So we refer to this as crashing. And a person who is coming off of cocaine will oftentimes report feeling depressed, having low energy, very little motivation. They might sleep for excessive amounts of time because cocaine will interfere with your sleep and so forth. So this is what we call a cocaine crash or crashing. Now, cocaine abuse and dependence, we know that regular use of cocaine will lead to a pattern of abuse and ultimately dependence. So what's going to happen long term is that the use of cocaine is going to start to interfere with friendships, romantic relationships. It's going to start to interfere with work. And you might say, well, that makes little sense because cocaine is going to increase alertness, increase energy levels. Well, it also increases irritability and conflict. So we have to be mindful of the negative side of cocaine use as well. And then ultimately, a person may feel that they need to use cocaine to perform a specific task. And that's what we would refer to as a cocaine dependency. Now, cocaine comes in different forms. So historically, cocaine was considered a status symbol, and it was limited due to its high cost. So you had to have a decent amount of disposable income in order to be able to purchase cocaine. So if you look at this top picture on the right, you will see lines of cocaine being snorted in a rolled up $100 bill. Well, that picture is actually fairly consistent with the status. People would roll up $100 bills because it was a message, I got it like that. However, what people started to realize was that they could isolate the active ingredient of the cocaine and make it more concentrated and turn it and fill it with other agents and turn it into a cheaper form. And when you hear the term crack cocaine, that is a crystallized form of cocaine, which they have a whole bunch of fillers, cutting agents, and so forth, which are problematic. But whereas the powder form cocaine is snorted, the The crystallized form is most of the time smoked in a pipe or inhaled in a pipe. So it is heated, as you can see in the bottom picture. It starts to dissolve, but there are other ways a person can use it. They can inject it similar to heroin, but in any event, the most common way to access the crack cocaine is heating, and the most common way of smoking it is through a what is referred to as a crack pipe. Now, when we look at the rates of cocaine use, we see about 0.5%, so roughly 1 out of every 200 people age 11 or above would meet the criteria of a cocaine use disorder who develop this abuse or dependency every year, 1 out of every 200 people. So what that turns into is millions of people, right? So if you think about it, probably 1.5 million people, rough numbers, who are abusing cocaine at this moment. So what's the big deal, you might say? Well, what are the dangers of cocaine use? Well, we know that there's physical dangers. The biggest physical danger is overdose. And if a person has a bad batch of cocaine, it is possible that it can induce a heart attack or respiratory problem. These two things are very, very significant and are common reasons why people die due to the use of cocaine. Where we want to also talk is about expectant mothers. So pregnant women who use cocaine have a higher rate of miscarriage and premature birth, as well as a whole host of physical and cognitive abnormalities. So using cocaine can affect you or can affect a developing fetus. So we talked about cocaine as one of the stimulants. Let's talk about amphetamines. When we think about amphetamines, you're probably thinking of the pill form of amphetamine, such as Ritalin or Adderall. Most of the time, this is prescribed for the purpose of attention. So if a person has ADHD, they might be prescribed an amphetamine. Or if they have narcolepsy, or what was the other one? It doesn't matter. So amphetamines can actually serve meaningful stimulant properties, but it can be also misused. So there's a whole flooding of the market of illegal amphetamines that are then converted into the drug market. So there are people who take the pill form or the capsule form of amphetamines, but some people inject the drug, smoke the drug for more powerful effects. And like cocaine, amphetamines have very similar stimulant properties, such as increase in energy and alertness, decrease appetite. There it was. An off-label use of amphetamine is weight loss. So reduced appetite. But you also can have, if you have excessive amounts of the drug, amphetamine intoxication can induce psychosis. And you can have the same crash during the withdrawal effects. So we do see the same emotional letdown as amphetamines leave the body. So how do amphetamines work? From a neurotransmitter point of view, they increase dopamine, norepinephrine, and serotonin. These are monoamines, and they affect mood. But the problem is that tolerance builds very quickly, and a person can easily become dependent upon it, right? So if a person tries to stop amphetamine use, they can wind up in a significant depression, significant sleep pattern, similar to cocaine. But roughly 1.5% to 2% of Americans will become dependent on amphetamines at one point or another in their life. So if we take the 2%, that's roughly 1 out of every 50 Americans will become dependent on amphetamines. So even the pill form of amphetamine has the potential for addiction. So we do want to talk, and I'm sure that this has become fairly popularized through Breaking Bad, the television show. There's one form of amphetamine called methamphetamine, and methamphetamine has surged in its popularity, similar to crack cocaine. It is cheaper and easier to access, and roughly 6% of people 11 years old or older have tried this. That's 1 out of every 16 people in the United States 11 years old or older have tried. And most of this meth is made in clandestine laboratories or stovetop laboratories. If you go back to the first season of Breaking Bad, it shows a pretty good picture of them creating this meth in a RV. And that is, I don't know if that's the common case, but that kind of production in a clandestine stovetop laboratory is a pretty good picture. So this is a basic understanding of stimulant use disorder. So hopefully you have understood how we diagnose a stimulant use disorder, some of the properties of intoxication for cocaine and amphetamines, some of the withdrawal effects, and the various subtypes of the drugs. And if you learned something new, if you found this video meaningful, hit the like button, subscribe, click the notifications tab. And I always ask at the end, if you could please, if there's something that piqued your curiosity, if you want to add a comment, type it below. I read and respond to every comment that I get. So I look forward to hearing from you. And until next time, take care, everybody.